The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Today on Meet the Doctor, my guest is Eugene plastic surgeon, Dr. Kiya Movassaghi. Welcome, Dr. Movassaghi.
Thank you for having me.
Tell us a little bit about yourself, especially from the perspective of what you want patients to know about you.
Sure. I'm a plastic surgeon in practice for the past 21 years now. I've gone through many years of training, including 14 years after college, focusing on medical education. I've got all my training done at Harvard Medical School. So it was Harvard Medical School, then I did Harvard Dental School, then I did general surgery, and then I did plastic surgery at Harvard Combined Program with a focus on craniofacial. And then when I finished my training, I moved to Eugene, where I've been practicing since 2002. My focus has always been quality and providing the best possible outcome that I can provide to my patients, treating patients like I would treat my own family, and I would do the best to achieve the best outcome. And I'm always striving for doing things differently in a better fashion. I'm very critical of my own results. So if there's something that I'm not happy with, I always strive for improving it. As a matter of fact, things I do now, I wasn't doing even 5 years ago, 3 years ago. I keep evolving. And because of that passion, I have become a national and international teacher. So I do a lot of teaching. I published a textbook on breast surgery, shaping the breast. So I go around the country and the world, talk about these topics. I have pioneered different techniques of facelifting and different concepts in facial rejuvenation. Again, that's something that we're working on writing. So I do a lot of publications because education and, striving for better outcome is my passion. I used to be part of a residency program at OHSU, and I would have residents spend time with me to educate them on cosmetic surgery. But about 8 years ago, I established my own aesthetic fellowship. These are for surgeons who finish their residency and they want to have a focused year of training by somebody who's an expert in the area, and they spend a year. So they go through a very arduous process of interviews and matching and everything like that, and then they match and they spend a year with me. So that's something that I'm proud of, and it's probably one of my best accomplishments for the past 8 years to educate the future of the aesthetic surgeons.
You mentioned in your training that you had done dental,
yes,
and craniofacial.
The craniofacial was part of we had some elective time, 6 months, so I kind of spent 6 months at Mass General with Dr. Mike Urimchuk, who's a very famous plastic and craniofacial surgeon. And I had a specific interest on that area, so he was spending a lot of time with him. And I learned a lot from him on craniofacial surgery. And as a matter of fact, because of my background, my training and dental degree as well, I think it has made me a much more proficient and expert in the area of the face.
That was where I was going with that. Did the dental and the craniofacial, that extra education, give you any advantages or change the way that you think about the face?
Absolutely. And when I look at the face is not just a soft tissue. There are layers of tissue that forms the face. It starts with the skin surface and fatty layer, the muscles underneath it. Then you have the bone, and then you have the dentition and the body, what we call occlusion. Those are all the structures. So the infrastructure is what forms the face. As a matter of fact, when I analyze the face, there are times where I say, your bite is this, and you should go get your bite fixed by an orthodontist before I would do a face work for you. Your result would be better. Or sometimes patients come in with, a deficient bony structure, whether it's congenital, they're born with it, or whether it's developmental or aging process where they actually lost some volume. So we have to reestablish that. Sometimes I put implants to re-augment the cheeks, the chin. But those are things that I can bring to the table because I understand the whole face inside out.
How does someone's face change on the inside, especially that bone, over the course of your life? I think A lot of us think your skull is just your skull, but it changes, doesn't it?
Changes, absolutely. The aging is multidimensional. Is skin changes, so you have the aging process of the skin, soft tissue, the fat. A lot of times, patients' faces shrinks, and you actually lose volume. So you may gain volume in certain areas, but you lose volume in certain areas. For instance, if you look at some of the athletes, they have sort of this very depressed mid face. They lost that mid face fat. So you lose that. And then also, as we've seen by looking at CAT scans of the face with time, there is resorption of the bone. So you lose, again, some of the depression that you see in the mid face of the patient is from resorption of the bone. So when you go into about rejuvenation, it's more than just pulling the skin up. You got to do all the layers. A good outcome is when you look at somebody's face and say, you look better. Are you sleeping better? They don't know why you look better. Nobody should tell you, did you have a facelift? That's bad outcome. If somebody knows you had a facelift, that's a bad facelift. If somebody tells you you look good, but they can't figure out why you look good, or you tell somebody my age is this and say, oh, really? You look a lot younger. That's a compliment. That's what I want my patients to hear.
At about what age does the bone in your face start to disappear?
Obviously, part is individual issue. We all age differently based on our genetics, based on our diet, based on our environmental exposure, your ethnicity. So it's a multifactorial. But, as you start noticing that resorption process, your 30s, 40s, 50s, 60s, it goes on.
I think the way this came up last time I remember discussing this was I was joking about that. I think it's a myth but they say your nose keeps growing as you get older. And I think the surgeon said that's actually not what's happening. I think that your face is getting smaller. Your bone is getting smaller.
I think there are some changes with soft tissue of the nose that gets a little bit elongated and they're more lax. And, you could see that if you have a tendency with the nose, has a tendency with, some hump and the tip dropping, that probably can get exaggerated.
Have you started to talk with your patients about planning how they're going to treat their faces or their bodies over the long term in a way that's more than just the issue that they're coming to you for on the day that they see you?
It's a very good question. As a matter of fact, that's where the medicine in general is going, but it's specifically in aesthetic surgery and aesthetic medicine. That's the future. It's about not just regeneration and rejuvenation, but also prejuvenation. Because we all have lifespan, right? So how can you expand that first part? You're kind of a younger, youthful version of you. How can we expand, elongate that period of time so you spend more in this side of the spectrum than the other side where you're older and you come in to rejuvenate? So a lot of the technologies that are coming out is how can we elongate that portion of your life, your appearance. So patients are coming in at a much younger age for skincare. We have a lot of technologies that can help you to maintain the collagen level in your skin and also tightening of your skin. We have technologies that are now skin products that we can introduce into the skin, and we have ways to have as a conduit that can allow for these products to better penetrate your skin. So a lot of stuff that we can do to prejuvenate your skin. So by the time you get to your 40s, people say, oh gosh, you look like your 20s. That would be the idea.
Yeah. Yeah, that would be nice. Is there any technology you're particularly excited about?
Again, it starts with this surface of the skin. So if you take care of your skin, it's just like, the analogy I use, and I'm a dentist also. So analogy is if you floss and you brush your teeth every day and you see your dentist every 6 months for cleaning, when you're 90 years old, the chances are you're still going to have your own teeth. In the old days, so that's your prejuvenation, right? You're keeping your teeth that you have. In the old days, by the time people were 40s and 50s, they all had dentures because they didn't take care of their teeth. The same analogy, if you take care of your skin at a younger age, you're not going to change your genetic, but you can change your behavior, you can change your environmental exposure and how you care for your skin. If you take care of your skin at a young age, for instance, with a good skin product at home on a daily basis, there are a lot of good products out there. minimize your direct sun exposure, especially if you have a very fair skin, like we call Fitzpatrick type 1 skin. Minimize that and come to the office for professional care, like, get hydrofacial every a few months. Get some microneedling, RF microneedling. As a matter of fact, I've had that myself, and it's a great procedure to rejuvenate and create some collagen, get some tightening of your skin. So do those things, get your Botox done. Botox is not only to make you look better, but also to prevent it from getting worse. If you do Botox starting your 20s and 30s, I can guarantee you by the time you get to your 50s, you will have no wrinkles where you've done the Botox. So best treatment for wrinkles is prevention.
When I started maybe 5 years ago, maybe longer, time goes by too fast. I had really, really strong forehead muscles, and I just looked so mad. But even now, even when my Botox wears off, they're not there anymore.
Yeah, exactly. And also, Botox kind of interferes with the muscle memory and how your brain, because a lot of times we have animations, but when you don't go to those animations, many animations are learned behavior. So if you don't go there for a while, you kind of lose that memory.
No one has told me how mad I look for years.
The whole time I'm still looking at you, I'm like, why are you so happy?
Well, thank you. Yeah, that I go to Restora in Austin, where Ashley Gordon and Dustin Reed. Yes, thank you.
Good friend of mine.
Mm-hmm. They're great. Take us inside the non-work you. What do you do away from the office?
Family is very important to me. When my kids were at home, I'm an empty nester now. When my kids were home, we were engaged with them. Went to all their activities. They were athletic, so they were doing sports stuff, and I would go to all the matches. Sometimes I actually would get too competitive that they would have to take me away.
Oh, you're that guy.
One of that guy. But so that was very important to me. And then obviously I spent a lot of time with my wife. We've been married for 32 years, been together for 36 years. So we do a lot of stuff together. And I also a big believer in athletic and taking care of yourself. I don't preach this just to my patients, how to take care of yourself, but I do the same thing. So to me, I've actually started a task force for the society, physician wellness, because we come across as major physical and emotional burnout among the surgeons, especially plastic surgeons. This is a very emotionally taxing, specialty, especially when you're in the aesthetic field, because you're taking patients who are feeling well, you make them feel worse and look worse so that they feel better in the future. That journey can be very emotional for everybody, for the patient and for the doctors. And you have to so you do that day in and day out. So it's like a overuse injury in like muscles. Well, it's an overuse injury your emotions. And you get burnout. Physicians get burnout. And then on top of that, all the office stuff that we have to do and management. Business owner. So a lot of that stuff can wear us down. So I think the physician burnout is very important issue. Unfortunately, suicide among physicians, especially surgeons, is very high. So we have to intervene. So to me, I've been a preacher on that. As a matter of fact, when I was the president of the Northwest Society 6 years ago, my invited guests were one person talked about the burnout and the other person talked about the physical stuff, how to stay healthy. Because on top of the emotional side, the physical side, this is also a very taxing procedure because during the surgery, we have our body placed in certain positions for long periods of time. A lot of things that we do, it requires very steady hands. So you kind of maintain that static position for a long time, and it's not good for your spine, it's not good for your hands, not good for your shoulders, neck. A lot of my colleagues at a young age, they're having spinal fusions and surgeries and all kinds of rotator cuff problems. So we have to take care of ourselves. So I'm a big preacher on that. So that's a big focus of mine. On a personal level, I work with a trainer twice a week. I train for triathlon, so I do races. Actually, as a matter of fact, I did the triathlon race last weekend. So to me, I spend a lot of my free time on personal care.
If someone's interested in coming to see you, where should they look for you online?
A lot of my patients, I would say 50% of my patients come from out of my area. So I have a lot of patients come from out of town, out of state. part of it is word of mouth and reputation. I do a lot of talks, so people get to know me. Even my colleagues sometimes send their complicated cases to me to fix. Also, a lot of patients come these days from social media. They come to me and I said, where did you come from? Oh, Google search or some kind of social media. So you have to be visible in the social media. Again, depends on your patient type. Your my face-to-face patients don't come from social media. But the younger, the tummy+tuck patients, the mommy+makeover patients, the breast patients, they tend to come from social media. So yes, social media is strong. We have a good following in the Instagram. We're present in Facebook, all different kind of modes. And then we are on Google search, we're number one always.
If you can spell it, you can find it.
Mm-hmm.
What's
even if you type in, plastic surgery Oregon or plastic surgery Eugene area, whatever, I'll pop up.
And what's your Instagram handle?
Dr. Movassaghi.
Okay. Wonderful. Well, thank you for spending some time with us today and sharing your stories with us.
Thank you for having me.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.